be here today to discuss the systemic health issues facing youth in the juvenile justice system. As a physician taking care of detained youth on a daily basis, and as a researcher interested in their health outcomes, I have three main points I would like to share with you today. First, we already know that justice-involved youth have more medical and mental health problems than other adolescents. But we now have data to suggest that their unmet medical and mental health needs are much more severe than previously understood. Second, we need to better integrate the various systems serving youth in juvenile justice, and to encourage more collaborative approaches, as we've already heard, in addressing their significant needs. And third, I believe we meet at a promising moment in history, a time in which justice-related legislative reforms and the evolving healthcare landscape together create a unique opportunity to effectively address these important issues. Others have already discussed the health issues facing youth and young adults involved in the justice system, including the fact that many have multiple, often quite complex medical conditions and health conditions. Research suggests that up to 90% of all detained youth have dental problems, approximately 80% have at least one mental health diagnosis, half have a physical health problem, and as many as 22% of the girls have previously undiagnosed sexually transmitted infections. As the medical director of Santa Clara County Juvenile Custody Institutions, I routinely see young people with multiple poorly managed health problems that have a high likelihood of long-term negative consequences. For example, I've cared for homeless type 1 diabetics with poor access to insulin and poor access to clean needles, as well as pregnant women with severe abdominal infections caused by untreated chlamydia or gonorrhea. I've also seen kids whose health problems were intimately connected with their illegal behaviors. Our clinic has cared for many youth with untreated depression who have resorted to substance abuse for relief. And we have seen victims of sexual and physical violence who have subsequently moved in and out of the foster care system, often relying on prostitution for money, food, or clothing. Hearing thousands of such stories over the years has changed my thinking about the real needs of this population. Is it possible that some are involved in the justice system as a result of their unmet health needs? Has arrest and detention become the surest entry point into the health and mental health system for our least advantaged youth? And might adequate health care in our communities have actually prevented some of these youth's involvement in the justice system? The severity of the health problems I see on a daily basis in the juvenile hall clinic often shocks me. These young people sometimes require more extensive, expensive, and invasive treatments than they likely would have needed had they gotten timely care prior to detention. In the most severe and extreme situations, some have even required expensive inpatient care in the hospital setting. This need for hospitalization reflects both the intrinsic severity of a health problem and the magnitude of the unmet health needs of a patient. But to date, no researchers have looked at the causes or frequency of hospitalizations in this vulnerable population of children. In an effort to understand these issues, our group at the Stanford School of Medicine and the Lucile Packard Children's Hospital examined all hospitalizations among detained youth ages 11 to 18 in California over a 10-year period. Our initial findings confirm our clinical suspicions. While these youth had serious physical and reproductive health issues, mental health problems were by far their most prevalent and serious. Of the almost 9,000 hospitalizations in this group during the study period, approximately 65% were for mental health problems. Examples of the causes of hospitalizations included severe depression with active suicidality, psychotic breaks, life-threatening substance abuse and withdrawals, and severe debilitating anxiety. In comparison, only 20% of hospitalizations among the general adolescent population were for similar problems. For detained girls, the findings were even more dramatic, with over 75% of hospitalizations being mental health related. Please note that these were young women with mental health problems so severe that they were sent from locked facilities with constant adult supervision, often including trained mental health staff, to a hospital for the most intensive mental health care. Most striking, mental health hospitalizations for detained youth were remarkably long. Average length of stay for mental health related causes were 3 to 5 times longer, depending on the diagnosis, than for adolescents in the general population. The largest difference in length of stays was among the young men, likely related to the detained male's higher severity of illness. Taken together, These early data suggest that detained youth in California suffer from significant unmet health needs with risk for very serious consequences, even before they come into custody. Especially in the area of mental health, those unmet needs can be so severe that they lead to long and costly hospitalizations. As has already been discussed, and as anyone who works with juveniles in the juvenile justice system quickly realizes, there are multiple agencies attempting to address the legal, social, economic, medical, and mental health issues in this population. Rarely do these groups effectively coordinate to improve the wellness and life trajectories of the youth. Disciplinary fragmentation is the major barrier, I believe. In isolation, the individual roles of law enforcement, probation, mental health clinicians, medical providers, criminologists, and policymakers all seem to make sense. Yet as a whole, the system doesn't serve the needs of the youth, especially in the context of their individual stories. I recently cared for a 15-year-old boy who had witnessed his father's murder at his home 6 months prior. He subsequently had difficulty concentrating and described experiencing sudden and unexpected flashes of anger and fear. He had even begun carrying a gun under the misguided impression that it would help protect him. Was this young man a criminal? Or was he a victim of severe emotional trauma? How might the juvenile justice system maximize his chances of living a productive life? We need a better way of addressing the unmet needs of this population. We need to make sure that the juvenile justice system is not the primary entry point to mental health services for our young people, a situation that's analogous to under and uninsured patients using costly emergency room services for their primary health care concerns. I recommend the following approaches based on a lot of what other people have stated here in improving the health outcomes of justice-involved youth. First, ensure that each juvenile detention system employs systematic, directed evaluations to diagnose and treat the health problems of its youth during detention. Without a more comprehensive understanding of their underlying needs, we cannot expect to have a positive impact. This is again especially true when it comes to mental health services. Second, establish strong and formal links between detention clinicians and community-based health resources. Given the complexity of their health conditions, these youth require consistent and effective long-term care after release. Those of us working in detention facilities must ensure that our efforts do not go to waste once a child is back in the community. I believe recent healthcare reforms should at least begin to remove lack of insurance as an access barrier once these youth are released. And finally, encourage innovation through continued incentives for cross-discipline collaborations. Breaking down the artificial barriers of departments and agencies and funding streams and ideologies is not easy. But I'm convinced that this is the time to get the various stakeholders, including academicians and policymakers, in the same room to identify gaps in services, reduce duplicative existing programs, and create and evaluate more effective interventions.